Good evening. My name is Kimberly Kuhman, and I serve as the Executive Director for the National Spasmodic Dysphonia Association. We'd like to thank everyone for taking time from their busy schedules to join us this evening for the organization's first webinar. We are excited to find new and different ways to connect with our community and appreciate the overwhelming response we received for this webinar. Within the last couple of years, there's been an exciting increase in interest in spasmodic dysphonia. And by the end of our hour together tonight, we hope that you will have a better understanding of the various projects being conducted. We appreciate your support of the NSDA as it allows us to continue to move this research forward. Our speaker tonight is Dr. Christy Ludlow, who serves as the NSDA Scientific Director. She is currently a professor of communication sciences and disorders at the James Madison University in Virginia, after spending over 30 years at the National Institutes of Health. She is currently leading Project 3 of the Dysphonia Coalition's grant through the Office of Rare Disease Research to develop better diagnostic tools for spasmodic dysphonia. Her dedication to the spasmodic dysphonia community has been instrumental to the organization and to the field. Before we get started, there's just a couple of housekeeping items. This webinar is being recorded and will be posted on the NSDA website if you'd like to view it again, or for those who were not able to join us this evening. If you experience any technical difficulties during the webinar, please email me at nsda@dysphonia.org, and we will try to assist you. Because of the amount of people registered, we chose not to have a call-in option, but rather have participants listen via their computer speakers. We do encourage questions and ask that you type them into the question panel so Dr. Ludlow can view them. We will hold most of the questions to the end of the presentation. Dr. Ludlow, we will now turn the program over to you with our appreciation for your time this evening.
Well, thank you very much, and this is very exciting to be doing a webinar. I may sound a little sniffly because I'm getting over a cold, so please forgive me for any non-usual sounds, and I hope to get through this without having too much problems. The purpose of this webinar is to talk about recent understanding of spasmodic dysphonia based on some of the publications in the literature, and also to talk about the new studies that are being funded by the National Institutes of Health on spasmodic dysphonia. And this funding is a direct result of efforts by the NSDA to urge Congress to support funding for research in spasmodic dysphonia. So much of what I will be talking about tonight is a direct result of the efforts of the NSDA, and it'll show you how instrumental the NSDA has been in forwarding future directions towards improving the treatment and understanding of this disorder. So the first study I'm going to be talking about is a study that was done by Christine Tanner at the University of Utah, where they looked at the characteristics of 150 patients who have spasmodic dysphonia. And some of these characteristics are going to be no surprise to many of you. 63% were female. 76% had a gradual onset of their disorder, usually between 1 and 2 years, and then the disorder remained chronic or the same after that. 27% had voice tremor in addition to the symptoms of spasmodic dysphonia. And of those people with voice tremor, about half of them reported some benefit from medications. And that is not unusual in people who have tremor disorders. Of those that were seen at the University of Utah Medical Center, 96% received treatment, and 89% of those received botulinum toxin injections, with a very large percentage having benefit on their voice. 59% had voice therapy at some point, and of those, 22 reported some benefit. And 7% had had the surgery, the SLAD surgery, and of those, 45%, or just a little bit less than half, had reported some benefit. Now, changes over time, this is one of the things that many people ask about regarding spasmodic dysphonia. Is it going to get better? Is it going to stay the same? Or is it going to get worse over time? And so they asked this question of people who had had spasmodic dysphonia for several years. 21% reported that the symptoms or the disorder had gotten better over time. 34% thought it had gotten worse over time, and this was in 87% of those people reported that it had been gradually getting worse over 10 years. And half, 45% or almost half, said that the symptoms or the disorder had remained the same since they had gotten it. Now, one of the things that's become of interest in medicine in particular is how disorders affect the quality of life, how it affects people's everyday functioning. And there's a quality of life questionnaire that they gave to their 150 patients at the University of Utah, and all those people reported some change over time. They reported that the physical aspects of the voice disorder had increased gradually over time, that their overall severity or the effect on their quality of life had increased over time, but that the social and emotional effects had increased to less of a degree. And that's probably because many of them, or at least almost 87%, were receiving treatment while they were studied at the University of Utah. Now, as I mentioned earlier, 21% had tremor in their voice, in addition to the symptoms of spasmodic dysphonia. And in the people, whether they had tremor or not, there was no difference on gender, symptom progression, or frequency of voice therapy or surgery. So the tremor, whether there's tremor or not, doesn't seem to make much difference in the course of spasmodic dysphonia. And as I mentioned, however, earlier, that the patients with tremor usually showed more improvement over time from medications. I don't seem to be going ahead for, here we go. Now, there's also been studies of anxiety and depression, because many people have been concerned about whether anxiety and depression are part of having spasmodic dysphonia, or whether they're part of whether you've had a voice disorder or not. That is, if you have a voice disorder, you might have more anxiety and depression secondary or as a result of the voice disorder, rather than the voice disorder being part of anxiety and depression. So this study that was done at Emory University in Atlanta, Georgia, was done on 128 persons with spasmodic dysphonia. And they found of those 128 people, 28% reported depression. And they compared these people with other voice disorders, another voice disorder called muscular attention dysphonia, which is thought to be a different disorder from spasmodic dysphonia. And they found that of the persons with muscular attention dysphonia, 36% of them reported depression. So there was a similar proportion in the people with spasmodic dysphonia to the people with muscular attention dysphonia in their frequency of report of depression. They also asked whether people with spasmodic dysphonia reported anxiety, and about a quarter of them reported that they felt they had some degree of anxiety. But about the similar proportion of people with muscular attention dysphonia also reported anxiety. They found that the degree of depression was related to some degree to how long people had had the disorder. And so both groups who had had the disorder longer had more depression. So they concluded that depression and anxiety are the result of having a voice disorder rather than causing a voice disorder or being part of the voice disorder per se. Now, another case control study where they're comparing people with spasmodic dysphonia with other people was done at the University of Utah and published last year. And that was also done by Christine Tanner. And they compared people with spasmodic dysphonia with people with other head and neck disorders. So they wanted to see if there are certain characteristics that are more frequent in people with spasmodic dysphonia with or without tremor compared to people with other head and neck disorders. They found some problems such as hand tremor, blepharospasm, which is uncontrolled blinking or squeezing of the eyelids, social anxiety, and a family history of voice disorders were more frequently occurring in the people with spasmodic dysphonia. They also found that the people who had tremor with their spasmodic dysphonia had a family history of essential tremor, head and neck tremor themselves, had a report of immune disorders or thyroid problems, and a more frequent report of panic disorder. However, the people with spasmodic dysphonia without tremor also had hand tremor, blepharospasm, and social anxiety. So it looks like these kinds of disorders seem to be associated with spasmodic dysphonia, and they're probably because there might be a genetic factor that makes people at risk for spasmodic dysphonia and also makes people at risk for some of these other disorders such as tremor. They also examined whether family members of the people with spasmodic dysphonia were more apt to report some of these same disorders. And they found that in the family numbers of people who had spasmodic dysphonia with tremor, that many of their family members reported a history of essential tremor. And this could be head tremor, hand tremor, or other body parts. They also found that many of the family members had more frequent tic disorders, eye diseases, ocular diseases, meningitis, and cancer and compulsive disorders. So these seem to be related in perhaps to some genetic risk factors that are responsible for both patients having spasmodic dysphonia with tremor and their family members. They also looked at people who had spasmodic dysphonia only and looked at without tremor and looked at their family members. And they found that their family members also had more instances of essential tremor, tics, asthma, and cancer. So these seem to be suggesting that there may be some genetic risk factors that underlie spasmodic dysphonia and relate to some of these other disorders. They looked at extended families, that is, where it was somebody distant from you, not a brother or sister, but more of a cousin or an uncle and aunt. And these extended family members of people who had had spasmodic dysphonia with or without tremor, they found that immediate families of spasmodic dysphonia patients plus tremor had had cancer and neurological disorders, and immediate family members with patients with spasmodic dysphonia only also had other neurological disorders and cancer. So there do seem to be both extended and immediate family members having more of some problems than others in compared to people who have other head and neck problems but don't have spasmodic dysphonia. They also looked at environmental exposure. Many people have remarked, maybe I was exposed to something in the air or some other virus that was related to me having spasmodic dysphonia. So they asked people with spasmodic dysphonia with or without tremor whether there were other environmental exposures that they might have had, such as an upper respiratory infection. And 14% reported that they'd had upper respiratory infections. Mumps in childhood seems to be a recurring theme. There was a previous study that showed that mumps in childhood seemed to be related to the occurrence of spasmodic dysphonia. And this was reported in this study by Christine Tanner as well. Neck and throat tension was reported. But that's hard to tell whether that's secondary to the spasmodic dysphonia. That is, if you have a voice disorder, you might have more neck or throat tension anyway. Patients who did not have tremor but just had spasmodic dysphonia also reported similar findings: neck and throat tension, mumps in childhood. They reported more occupational voice use. That is, they were people who used their voice a lot at work, such as teachers, or volunteer voice use. That is, people who did a lot of speaking on a volunteer basis to groups or to other people for various reasons. Now, most recently, just this year, there was a case control study comparing spasmodic dysphonia with other voice disorders. So we're now trying to determine, we have two groups of patients, both with voice disorders. Are there some things that are more associated with spasmodic dysphonia compared to other voice disorders, such as muscular tension dysphonia? And the things that they found were greater in people who had spasmodic dysphonia compared to people who had other voice disorders was cervical dystonia. That's where the head gets turned to one side or front or back because of neck muscle cramps. Sinus and throat illnesses, mumps again recurs, rubella, dust exposure, and frequent volunteer voice use. That is, people were using their voice a lot for either coaching or other reasons that were volunteer activities. A family history of voice disorders is more frequent in people who have spasmodic dysphonia, and an immediate family history of vocal tremor or meningitis, which is an infection of the linings of the brain. An extended family history of head and neck tremor, that is, you might have not closely related relatives such as a sister or brother, but more of a cousin or an uncle or an aunt. Those other family members might be more likely to have ocular disease or eye diseases and meningitis. So their conclusions based on these studies that I've just reviewed are that spasmodic dysphonia is more likely a multifactorial disorder. That is, many factors come together to produce spasmodic dysphonia, and that they're both genetic factors such as endogenous factors or exogenous factors such as exposure to virals, disorders such as mumps, rubella, other viral diseases. Voice use patterns, people using their voice more particularly for besides occupation, because most people use their voice in their occupation. And family neurological conditions seem to also be related to people developing spasmodic dysphonia later in life. So we're getting a picture of a cluster of certain things that seem to co-occur in people with spasmodic dysphonia and also co-occur in their family members. Now, one way to determine whether something is a risk for developing spasmodic dysphonia is to compute an odds ratio. And the way this is done is you measure the number of people with spasmodic dysphonia and the number of other folks who don't have spasmodic dysphonia who have that factor. If both groups have that factor to the same rate, they have an odds ratio of 1. That is, everybody seems to have the same risk of having that associated risk factor, regardless of whether they have spasmodic dysphonia or not. But if you have an odds ratio that's greater than 1, such as 2, that suggests that people with spasmodic dysphonia are twice as likely to have that factor compared to other people who don't have spasmodic dysphonia. So this is a model based on the studies that were done by Christine Tanner and her colleagues. And they identified certain risk factors which had odds ratios that were pretty high. So first of all, the relationship of essential tremor was very high, 7 times higher in people who have spasmodic dysphonia compared to people who do not. And also blepharospasm, which is that eye squinting, which is also thought to be a type of dystonia, was also 4 times more frequent in people with spasmodic dysphonia or their family members. So this suggests some genetic predisposition for the disorder. Viral exposures, remember we mentioned meningitis and mumps, also seem to be higher in people who have developed spasmodic dysphonia and in their family members, suggesting that maybe they're more susceptible to certain viruses or maybe have been exposed to those viruses more. And those aren't as high as the genetic predisposition, but 3.7 is pretty high, and 1.7 is certainly higher than 1. Now, people have asked whether voice use seems to contribute to spasmodic dysphonia, and there does seem to be a higher voice use in people who have developed spasmodic dysphonia, either related to their job, which is 2.4 times greater, or voluntary use of their voice, which is twice greater than compared to people who do not have spasmodic dysphonia. So this is a model of what we know thus far. It suggests that these multiple things interact in some way to put someone at greater risk of spasmodic dysphonia. However, you should remember that lots of people use their voice a lot. Lots of people are exposed to different viruses, and we think that many people have genetic predispositions. For instance, essential tremor is the most common neurological disorder there is. So it may not be one of these factors, but it may be the co-occurrence of these factors that put someone at greater risk of spasmodic dysphonia. Okay, so that is sort of a summary of what we've recently learned from some studies of what seems to be related to spasmodic dysphonia and what doesn't.